SIP and CIP in Cleaning Validation. Presented by Learn GMP Incorporated in collaboration with Technical Training and Consultation Service LLC. Introduction. In Cleaning Validation, CIP, Clean in Place, and SIP, Sterilize in Place, are automated techniques widely used in pharmaceutical, biotech, and food industries to ensure consistent, reproducible cleaning and sterilization of process equipment without disassembly. CIP, Clean in Place. Definition. CIP is an automated method of cleaning the interior surfaces of equipment like tanks, pipes, reactors, and filling lines without opening or dismantling the system. Key features of CIP. Used for tanks, bioreactors, pipelines, and filter housings, etc. Process. Circulation or spraying of cleaning agents, for examples, alkali, acid, and water. Steps are pre-rinse detergent wash, then intermediate rinse and final rinse. Equipment. CIP skid with tanks, pumps, valves, and spray balls. Validation needs. Chemical residue removal, TOC, conductivity tests, swab and rinse sampling. Benefits. Automated, consistent, repeatable, and safe. SIP, Sterilize in Place. SIP is an automated method of sterilizing equipment in situ, typically after a cleaning cycle, for example, CIP, using pressurized steam or chemical sterilant. Key features of SIP. Used for bioreactors, fermenters, tanks, piping systems, and aseptic lines. Process. Steam sterilization at 121 to 134 degrees Celsius for a defined time, for example, 30 to 60 minutes. Purpose. Kill all viable organisms for sterility assurance. Validation needs. Temperature mapping, biological indicators, and F0 calculation. Monitoring. Steam quality, pressure, condensate drainage, and temperature probes. Benefits. Non-invasive and reduces risk of contamination. In Cleaning Validation, CIP must validate residue removal, for example, API and detergent, using rinse sampling and analytical methods, TOC and HPLC. Conduct visual inspection and recovery studies. Establish acceptance criteria for chemical and microbial residues. And SIP follows CIP, Clean Sterile. SIP validation is often part of aseptic process validation, APV, or media fill studies. Microbiological residue testing is conducted before SIP. Post-SIP is considered sterile unless SIP fails. Summary. Clean in Place. Purpose. Remove chemical and microbial residues. Method. Chemical wash, detergent, acid, and rinse. Temperature range. 30 to 80 degrees Celsius. Validation tools, TOC, HPLC, and conductivity. Sampling type, swab and rinse samples. Usage, routine between batches. Sterilize in place. Purpose, destroy viable microorganisms. Method, pressurized steam or sterilant, e.g., VHP. Temperature range, 121 to 134 degrees Celsius, typically steam. Validation tools, temperature mapping, biological indicators, F0 calculation. Sampling type, rare. SIP effectiveness is proven via sensors. Usage, for sterile systems before aseptic operations. Regulatory considerations. FDA, CIP and SIP systems must be validated. Software must comply with Part 11. EMA, Annex 15. CIP and SIP must be qualified and integrated into cleaning validation. WHO. Cleaning validation should include automated systems where applicable. Thanks for watching our channel. Feel free to reach us at contact@learngmp.com for any training and consultation requirements.